It is very nice to greet you again. In today's video we will talk about the following: Cushing's disease in dogs, symptoms and what to do. To understand Cushing's disease, we must first look at the adrenal glands. These small glands, located near the kidneys, are responsible for producing cortisol. You may know cortisol as the stress hormone. In the right amount, cortisol is vital. It helps your dog respond to stress, control their weight, fight infections, and keep blood sugar levels under control. However, too much of a good thing can become a problem. Cushing's syndrome occurs when a dog's body produces an excessive amount of cortisol. Cushing's disease versus Cushing's syndrome. You may hear veterinarians use these terms interchangeably, but there is a slight technical difference that determines the treatment. Cushing's disease is usually caused by a benign, pea-sized tumor located at the base of the brain. This tumor forces the adrenal glands to work overtime, producing excess cortisol. This is the most common form and accounts for 80% to 85% of cases in dogs. Cushing's syndrome is the broader term for the condition of having excess cortisol. This can be caused by the aforementioned pituitary tumor, but it can also be caused by a tumor in the adrenal gland itself. Cushing's syndrome can also be caused by tumors in other parts of the body. Recognizing the symptoms. Since it usually affects middle-aged or older dogs, the symptoms of Cushing's disease are often mistaken for those of normal aging. However, if you observe a combination of the following signs, it's time to schedule a visit with your veterinarian. 1. Increased thirst and urination. You might be wondering, why is my dog so thirsty? Increased thirst is often the first warning sign of Cushing's syndrome that owners notice. You may have to refill the water bowl 3 or 4 times a day because your dog is drinking so much water. This is why it's common for them to urinate more frequently. Increased thirst and urination can also be due to other serious illnesses, such as diabetes or kidney disease. If your pet exhibits this symptom, they should be examined as soon as possible. 2. The belly in dogs. Does your dog seem to have gained weight in the abdominal area, even if they haven't overeaten? Excess cortisol causes muscle weakness and the redistribution of fat to the abdominal area. This, combined with an enlarged liver, another side effect, creates a distended and bulging appearance. 3. Changes in the skin and coat. You might notice hair loss, alopecia, usually on the body, not the head or legs. The skin may also become thin, fragile, and prone to infections or bruising. In some cases, hard calcium deposits may form under the skin. 4. Increased appetite. Cortisol stimulates appetite. Your picky eater might suddenly become voracious, constantly begging for food or even raiding the trash. 5. Panting and lethargy. Excessive panting, even when the dog is resting or in a cool room, is common in Cushing's syndrome. You may also notice that your dog tires easily on walks or has less interest in playing. How is it diagnosed? Your veterinarian will likely start with a standard blood test and a urinalysis to check for elevated liver enzymes and dilute urine. They may also perform an additional urine test called the urine cortisol-creatinine ratio. This can help rule out Cushing's syndrome. However, if the ratio exceeds a certain number, further testing will be needed. If these indicators are present, specific hormone tests will be performed. Treatment and management. Although Cushing's syndrome is generally not curable, unless caused by a surgically removed adrenal tumor, it can be successfully managed. For the most common form, medication is the standard approach. It's important to remember that managing Cushing's syndrome is a marathon, not a sprint. It requires regular monitoring and follow-up blood tests to ensure the dosage is correct. An insufficient dose of medication will not control the symptoms. An excessive dose can lead to dangerous side effects. With consistent care and regular veterinary visits, many dogs can go on to live normal lives with a good quality of life. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.